So welcome to the channel. So today we're going to go through a case study on episiotomies. So we're going to start with the first question, which is saying, what is the name of the procedure shown in the picture? Then B, at what point in labor is this one done? Okay. They name three indications. So on three indications for this procedure, then what are the complications? What are the four complications of this same procedure? So like I said, this is a case study on episiotomies. So the name of this procedure, since it's a case study, so the name is episiotomy. But so if you want, you can even put exactly say this is a mediolateral episiotomy. That's the name of the procedure, because this one is specifically mediolateral, because there are types of episiotomies. So there's a mediolateral, midline, a J-shaped, and so on. Then at what point in labor should this be done? So the right time to do this is during the right time to do this procedure is just during or at crowning, when there is bulging of the thinned perineum, when the edge is about 3 to 4 centimeters. So that's when you do this procedure. Okay. They name three indications, so we are now on indications. So indications for this procedure, we have rigid perineal muscles causing delay in descent of presenting part. You can also have, that was one. You can also have anticipating perineal tears, for example, in big baby, breech delivery, shoulder dystocia. Those ones are. So they fall under anticipating perineal tears. So we have now two indications. Then the third indication, you can have a previous perineal surgery. Let's say perineal reconstructive surgery. So we can do this since an episiotomy is done to facilitate delivery. So we can do an episiotomy in a previous perineal surgery patient. Then the other indication, which is the fourth indication, is that you can do this in instrumental or operative delivery. If you want to facilitate that instrumental operative delivery, so you can do an episiotomy before you actually do it. For example, before you even do a ventouse, you can actually do an episiotomy. Then the other is fetal distress during active pushing. So if you want to facilitate delivery, you can do, when the patient has fetal distress during the active pushing, you can do an episiotomy to facilitate delivery as well. So we are done with the indications, but these are not the only complications of this procedure. So they are not the indications. So complications, let's go to complications. So complications, we have wound dehiscency, we have infection, for example. So we have to specify which infection are you talking about. So we say wound infection. So this, if you make that incision, the other complication is that it can extend, or there will be extension of incision to involve the rectum. That will be one of the complications. So extension of incision to involve the rectum. Then the other complication is the vulvar hematoma. We can have a rectovaginal fistula, though this complication is very rare. So that's another complication. You can also have injury to the anal sphincter causing incontinence of flatus or feces. So that's also another complication, and so on and so forth. So that's the end of this case study. So thank you for watching. Please subscribe and remember to hit the bell notification as we do stations as case studies, instead of doing them all of them. Let's say if they are 10, you can just break them down into case studies. All right, thank you. See you on the next case study.